spend the majority of our time today talking about your plan. Okay, everyone. Today we're going to talk about your plan. We're going to cover some things about Medicare, but we're also going to spend the majority of our time talking about your plan. So everyone knows that Medicare is a program that is a part of the Social Security Act, and that if you're 65 and or disabled, that you can get it. The parts are made up of Parts A and B, which is original Medicare, Part C, which is a Medicare Advantage, and D, which is a drug plan. This is all part of Medicare Basics. And you enroll in Medicare. You enroll in Medicare when you're 65, or if you're disabled. If you continue to work, then you have some choices while you're working. I'm going to go through that very quickly when we get ready to go through that. The initial coverage period for people who are joining Medicare is they call it the initial coverage enrollment period. That is the 3 months previous to your birthday month, and the 3 months after. You should enroll in Medicare Part A. I tell everyone that if you have 40 quarters or 10 years of employment, then you should enroll in Medicare Part A immediately during that initial coverage enrollment period, that 7-month period, regardless. There is also something that because at this particular point, that Medicare Part A, which is the hospital coverage, it costs you nothing. If you worked your 40 quarters, it doesn't cost you. And while you continue to work, if you have Medicare Part A, it acts as a secondary payer. You should enroll in Medicare Part B when you're first eligible. And there is a caveat to that. Currently, your employer coverage, your group coverage that you have, is considered credible coverage both for medical and for prescription drug. You can defer this Medicare Part B coverage, which does have a premium associated with it. Currently, that's $144.60. You can defer that while you continue to work full-time and carry credible coverage, continue your employee group coverage. You can defer this until you actually retire. When you get ready to retire, you have to sign up for Part B, and they may ask for proof of credible coverage, which your benefits administrator can provide to you. You can defer that Part B. I make a caveat here also for those people who are retired military and are looking to do TRICARE for life. Regardless of whether you have group coverage or not, you must sign up for Medicare Part B if you have TRICARE as a secondary payer to your primary benefit, because the Congress passed that in an act in 2001. So if you do have TRICARE, that is something that you need to understand, that you still have to sign up for Medicare Part B. If you do not sign up for it when you're first eligible as a military member, if you don't sign up, then you run the risk of losing your TRICARE for life. So that was the one piece of information I wanted to add to that. Medicare Part A is hospital, and Medicare Part B is all your physicians, your outpatient. Think of it, inpatient in a hospital or a care facility, and outpatient is B. So A and B. And so with A and B, generally Part A pays 100% after you meet deductibles. And and then of course Part B has that 80. We've seen all the commercials with the 80-20, where you're responsible for 20%. Doctors that accept the Medicare assignment consider payment of that 20%, 20/80, those copay percents. Once they're paid, they're considered paid in full. This is I'm just going to leave this for just a second to show you some of the standard costs if you have only Medicare, original Medicare. And this will have a bearing as we go forward and look at the plans because your plan is much richer than the original Medicare. And of course, these are the things that Medicare doesn't cover. And one of the things I usually point out to people is that shingles vaccine. Well, it has been recommended that those folks that are over the age of 60 get the shingles vaccine. It's not covered under Medicare. Part C is a Medicare Advantage, which is what your plan is. You have a Medicare Advantage PPO plan. And you enroll in Part D at the same time, that 7-month period. unless you have credible coverage and you're continuing to work. Part D is drugs. So it's easy to remember. If D stands for drugs. And this is just a standard benefit for if you just had a separate Part D. Covered inside of your plan, you have drug coverage under the Medicare Advantage plan. There's also extra help out through the government and through the state for anyone that needs additional help paying for drugs, co-pays, and such. We're not really going to talk about Medicare supplement plans. Medicare Advantage plans are a plan that replaces original Medicare. It is not a supplement. It replaces original Medicare Parts A and B, and oftentimes has that Part D drug coverage, which your plan does. It does mean you still need to pay your Part B premium to the government. That's still a requirement because you have to be eligible for Part A and enrolled in Part B in order to be eligible for a Medicare Advantage plan. Medicare Advantage plans are offered by private companies, and it's not a supplement plan. I also tell people you cannot combine a Medicare Advantage plan with a supplement plan. Okay, so now let's go ahead and talk about.
May I interrupt just a moment? I have a question. Because the Medicare Advantage plan that the city is offering up includes Part D, does that plan cover the shingles vaccine?
Under the formulary, I don't have the formulary right with me. Can you look that up, please? And then let us know. I'd appreciate that.
Thank you.
So we'll get that question to be specific. Like I said, I don't have the formula. Okay, so I want to go over the plan now. This presentation continues to go into the plan, but I wanted to show you what a summary of benefits and what the summary of benefits will look with your enrollment. So instead of reviewing the plan through the presentation, I'm going to review the plan using the summary of benefits that you'll see when you work with Susie. Go back to the top of this thing. This is what it looks like. It's a 2021 summary of benefits. And so we're going to go through it. The very first part of the document, let's see if I can make it a little, I'm gonna make it a little larger. Whoa, hello, it got large. Okay, so it talks about who can join and the requirements for who can join this Medicare Advantage plan. In the very first part of this plan, the introduction gives you some basic information about the plan itself, also gives you information concerning original Medicare and different information you can obtain concerning original Medicare and where you can contact Medicare. Joining gives you the criteria for joining. Doctors and hospitals and pharmacies. There is a network. We have in-network and out-of-network with your PPO plan. If you go in-network with doctors and providers, then you receive a better cost share than you would if you were going to out-of-network physicians and providers. Though you can, under a PPO plan, you can go to out-of-network providers, but it's more cost-effective for you to stay in network. We also recommend and ask that you select a primary care physician, though it is not required. That primary care physician does provide you with a better coordination of care. Under a PPO, you do not have to get referrals. There may be some procedures that require prior authorization, but referrals are not necessary under PPO. Whenever you see this symbol right here, this diamond symbol, as we go through this, that will indicate something that may require what I said, which is that prior authorization. Your monthly premium is $271.34 with the Elite PPO. And of course, your in-network deductible, please note, is $0. You have no deductible if you're in network. If you're out of network, going to an out-of-network provider, you pay $1,000. That gives you the first indication of where it is more cost-effective to stay in network if at all possible. Your out-of-pocket maximum for the year, for the plan year, is $1,000. Once you meet that $1,000 by paying co-pays and co-insurance and any other medical service costs from in-network providers, once you've paid that $1,000, then Florida Blue will pick up the rest of the costs of any medical care 100% to the end of the plan year. If you're using out-of-network doctors and providers, then your maximum out-of-pocket goes from $1,000 to $3,000. And after you've met the $3,000 out-of-pocket costs, then Florida Blue picks up 100% of the cost at the end of the plan year. So that's the difference between in-network and out-of-network. So inpatient hospital is $200 per day for days 1 through 5. If you look at the plan that you have this year, one of the things that somebody noted to me was that this cost has gone up from $175 for days 1 through 7 to $200 for days 1 through 5 for in-network. Yes, that's true, but you also note that the days have gone down. So days 1 through 5. So after day 5, you are at zero copay versus that $175 for 7 days. So you're covered earlier if you have to stay in the hospital for a longer amount of time. Also, please note that if you stay in the hospital for 5 days, if you have a hospital visit for 5 days, you have then met your maximum out-of-pocket for the year, because that's $1,000. So your outpatient your outpatient hospital care is $75. You notice on the other side, most of it shows a 20% copay after you meet the yearly deductible in the out-of-network. Ambulatory surgical center care is $150. Doctor's offices, which hasn't changed. Your primary care has not changed from last year from the PPO 1 plan to this now Elite PPO. But your copay for your specialist visit actually has gone down. This year you're paying $30 for specialists. Next year you'll pay $25. Of course, there's a list of preventative care services that you will receive in network. There is no copay for in-network preventative care services. They're listed here. And if you go out of network, of course, that 20% coinsurance applies. After you, 20% of the Medicare allowable amount, which is your coinsurance. These are other preventative screenings. Emergency care. Under urgent care, you're paying $25. The urgent care services actually has gone down by $5 this year. So that's, there's some improvements that have been made within this program, within this plan. Diagnostic and lab. As you see, copay for an independent clinical lab, and we're showing $15 for outpatient hospital facility. X-rays have gone down. X-rays at an independent facility this year is $50. It's going down, being cut in half to $25. The same with the copay for outpatient hospital facility for X-rays has gone down by $50 from this year to next year. So you do have some really good improvements to this plan based on that. And the physicians, the advanced imaging services, MRIs, PET scans, CT scans, such like that. At a physician's office, it's gone down from $125 to $50. It's $50 starting in 2021. You have a $75 copay for the independent facilities, and that's down from $125. Your copay for outpatient hospital facilities has gone down from $150 to $100. So there's been some reduction in cost on those copays for advanced imaging services as well. Medicare covered hearing services, exams to diagnose and treat hearing and balance issues. You have a $25 copay. Dental services, the dental services that are covered are for non-routine dental services. If you have a disease or something that causes some issues with your with your mouth, and it's not routine, it's very likely, oftentimes it's surgical, or you get in a car accident and they have to do some reconstructive work. Those things are considered medical. They're medical associated with dental work or dental care that would need to be provided. So it's considered non-routine. Vision services, you have a $25 copay for physician services to diagnose and treat eye diseases and conditions. As you note, you have a $0 copay for a glaucoma screening once a year for members that are at high risk for glaucoma. A $0 copay for one diabetic retinal scan per year, and a $0 copay for one pair of glasses or contacts after having cataract surgery. Your mental health care for inpatient mental health is $200 copay per day for the days 1 through 7, and then $0 copay for days 8 through 90. And 90-day maximum life benefit in a psychiatric hospital, 190-day lifetime benefit maximum. Your outpatient for mental services is $30. Skilled nursing, if you need to go into a skilled nursing facility, generally this is done post-hospital stay. You have a $0 copay days 1 through 20, and then a $100 copay for days 21 through 100. And the plan covers up to 100 days of skilled nursing per benefit period. One of the things I point out when they talk about benefit period is considered the first day of the day that you go into a hospital or skilled nursing facility and from the day that you're admitted. Physical therapy, $25 per visit, which is down from previous years. Let me look that up. Physical therapy, yes, that's gone down tremendously. Physical therapy has gone from this year, physical therapy is $125, and it's going, oh, sorry, I'm looking at the wrong one. Sorry. Physical therapy is going from $30 to $25. Ambulance is not changed. Transportation, independent transportation to the doctor is not covered under this plan. Medicare Part B drugs. People ask me, well, what is Medicare Part B drugs? In addition to what you see there, also insulin with a pump, if you're using an insulin pump, is considered a Medicare Part B medical coverage and not under drugs. The majority of prescription drugs and drugs that you receive by injection are considered Part D for drugs, which is covered under your policy. Now let's talk about your prescription Part D. And in order to show you this, because I'd really like to show you the comparison of what is in the PPO1 plan this year versus what you're going to pay next year with the new Elite plan. So I have another screen to show you that will outline that side by side for you. And I'm going to expand the screen as well to make it large enough for everyone to see. And then we'll go over this plan. The plan, if you're looking on the left-hand side, this is the current plan for 2020. On the right-hand side, we have the plan, the 2021 plan. So we can look at them side by side. Okay, and as you notice across the top, we have in-network and mail order for 2020. In 2021, we have preferred, standard, and mail order. What preferred is there are preferred pharmacies that we have contracted with, and this allows us to provide better cost savings, not only for us, but also passing on that cost savings to you in the form of reduced copays. Preferred pharmacies being Walgreens, Walmart, Publix, PillPack is our mail order preferred. And we also have the Walgreens Alliance that we also have as a preferred. But for retail, we have those. Somebody asked me one time, well, is CVS considered a preferred? It is not. It would be considered a standard pharmacy. You could still get your prescriptions from them. But as we go forward, you'll see the difference in these two columns between your copays, what you'll pay, as you see with tier 1 drugs. In the new year, you're going to go from in-network of $10 to an in-network of $0 for preferred. But even in the standard, you do get actually a reduction of $2 if you go to a standard pharmacy, because tier 1 is $8. with, of course, a $0 copay if you do mail order. Tier 2 generics, $10 from last year is going down to $3 for a preferred. It's a little more expensive, gone up if you're using a standard. I do, of course, recommend if you can stay with preferred pharmacies. Obviously, they give you a great cost advantage. Tier 3 drugs, which are those preferred brands, last year that was $40, this year it's $30. So it's gone down $10. There's no difference if you use a standard, but you do get a cost savings this next year of $10. Tier 4, last year was $70, it's gone down to $60 under a preferred pharmacy. There is an increase under specialty drugs. Specialty drug costs have gone up to 33% for next year. Just to let you know that specialty drugs, people often ask me, what are specialty drugs? Specialty drugs are drugs that have a cost of over $600. Sometimes there are drugs that have higher risks with them. Some of them are newer drugs. Well, generally newer drugs tend to be very expensive drugs. So that is what tier 1 or tier 5 specialty drugs are. The one thing to note now, the same as last year into this year, you do have coverage through the coverage gap. The coverage gap, what everyone commonly knows is the coverage gap is actually, they call it the donut hole. This is the place where most people who have regular drug coverage with other plans would pay a 25% coinsurance for their drugs while they're in the coverage gap. Under your plan, you have coverage through the coverage gap. You pay the same copays and coinsurance under the coverage gap while you're in the coverage gap. So for you, you don't see a difference because you're going to pay the same amount in the new year as with the reductions that you have in each tier. The one that I want to talk to you about today also is if you get out of the donut hole at $61.50, total cost of $61.50 that has been accumulated for the payment of your drugs. If you go into what's called the catastrophic stage at the end, before the plan year ends, then what you will pay, last year it was the standard costs. This year you will pay $3.70 or 5% for generics, whichever is greater, and $9.20 or 5% for all of the other drugs, whichever is greater. And of course, the Elite plan does have a 90-day supply for mail order, 90-day supply. Preferred, 0 generics, $9 for a 90-day supply. Preferred brands, $90 for a 90-day supply. Tier 4, $120 for Tier 4 for a 90-day supply, and then that 33% under specialty drugs. So now that I've gone through these two, I also wanted to show you a couple of other benefits associated with your plan. One of those benefits is called Blue Rewards. Blue Rewards is available to you, and I wanted to show you what that is. The Blue Rewards program allows you to get gift cards for things that you would do for preventative screenings. And these gift cards, and you have to sign up for Blue Rewards through the My Link. I tell everyone, if you don't have My Health Link, which is the member portal for Medicare, go to floridablue.com/Medicare and sign up for My Health Link. And in there, it gives you a place for the Blue Rewards to sign up for Blue Rewards. Once you sign up for Blue Rewards, then you are eligible to then claim gift cards for these preventative services. Like if you get an annual wellness exam, PPO members get a $50 gift card. If you get a breast cancer screening, bone density, this is a nice one, you get a flu shot. If you get a flu shot, you get a $20 gift card. This is a way of encouraging everyone to get their preventative services, their preventative wellness care services, and Of course, the flu shot's really important. Of course, obviously, it's more important this year, even more so than in previous years. But even the screenings, if you get a retinal eye exam, you get a $25 gift card. The same with a urine test for protein. There's a $15 diabetic for the diabetic protein test, a $15 gift card that you get. So there are a number of gift cards that are eligible for you if you participate in the Healthy Blue Rewards and sign up through My Health Link. Sign in, get a login and password to My Health Link and sign up for the Healthy Blue Rewards. The next benefit that you have is Silver Sneakers. This is an additional benefit that you have. That Silver Sneakers is a fitness program. I talked about it earlier. Someone asked a question about a YMCA. Silver Sneakers is a fitness program, and it's a great way to help you stay safe. Now, a lot of people, there are some people out there, and I tend to be one of them, so I can sympathize that I'm not really a gym-going person. I don't like going to a gym. But Silver Sneakers has programs for people like you and me. You can go to a gym. You can join every gym in your town that participates in Silver Sneakers. You're not restricted to just one. Say you go to the gym and you like a class at one gym, and at another place you like the class at another place. You can join both of them. So it doesn't restrict you. You don't have to make a choice. You join the ones that are suitable for you. When you travel, you can use Silver Sneakers when you travel. You can go to participating gyms, gyms that participate in Silver Sneakers even when you're on vacation. There's an at home or to go. Silver Sneakers has on-demand fitness classes that are available all the time. They have live virtual classes, and they have something called Silver Sneakers Go. We all love the phrase, there's an app for that. Well, there's an app for Silver Sneakers Go. Also, if you would like to work in your home and you don't have any basic equipment, you go into Silver Sneakers and you select or talk to them. You can also call Silver Sneakers and tell them you want to do some things at home, and they'll send you videos and exercise bands, yoga mat. They'll send you items that you can use to stay healthy at home. There are also group activities that you can do with other Silver Sneakers members, and they have all kinds of events. My aunt and uncle are in their 80s, and they spend 3 days a week at the gym with their other Silver Sneakers, with the other Silver Sneakers members. And then they have 1 day a week that they go out and do a group walk. And then the other days they do just walks around the neighborhood. But they're still participating in Silver Sneakers. Now, in light of COVID, there are some changes that have happened at most gyms. I know even with the Silver Sneakers that you have to make a reservation to participate in a Silver Sneakers class at a gym, at least the YMCA that my uncle and aunt go to. So I assume that a lot of them are taking extra precautions. But if you still don't feel safe getting out in that kind of environment, again, Silver Sneakers has a solution for you, and all you need to do is call them, and they will help you. So please participate in Silver Sneakers. Okay, with that, I'm going to stop my sharing so that we can see if there's anyone that has any questions. Susie, did you have additional information that you wanted to share?
I don't have additional information I wanted to share, but I do have a question that comes up quite often for people when they're filling out the Florida Blue Medicare application. It can sometimes be confusing to which plan to pick because you have to fill in, do I want what medical plan and what prescription plan? So on this year's plan, I'm assuming I should advise people to pick the Elite PPO medical plan and the Partner Elite RX plan.
That is correct.
Okay. And then the next line on the form says, include dental, hearing, vision package. The answer to that should always be no, correct? Because that would be an add-on. It's not bundled in this plan that you just went through.
That is correct.
Okay.
Yes, it is not bundled, no.
Okay. So For anybody who is on the call, when you fill out the Florida Blue application, you do not have to do it every year. You only have to do it when you are first entering the plan or adding an eligible dependent to your plan. And those applications should be forwarded back into the benefits office at City Hall, not directly to Florida Blue, because I have to do some processing steps on them as well.
And Susie, to follow up on your question about the shingles, there is a shingles vaccine formula on the formulary. It's called Shingles, SHINGRIX. It's the preferred. So.
Okay. Wonderful.
And
Thank you,
I'll
Brenda.
after this call, I'll highlight it on the formulary and send it to you as well.
All right, thank you,
Okay,
Brenda.
what tier is that, Brian?
I believe it said tier 3. Let me just go back to it real quick. It says
Okay.
tier 3, and it says vaccines lifetime. So
Okay, so then if it's tier 3 and someone were to go to preferred retail such as Walgreens, they would pay a $30 copay for their shingles vaccine, correct?
That is correct, under preferred, yes.
Okay. Okay. I'm just checking to see
Okay,
if
did anyone have, we have a few participants, did anyone under, did any of our attendees have any questions that you wanted to direct to any of us on this
most
on
of
this
the
panel?
questions.
We have with us, I know you can't see her, but I'm going to ask her to start her video so that you can see her. There she is. Hello, Athena.
Hi.
Athena is with your Gearing Group, and she provides help and support when you have issues or questions concerning your benefits. And she and Nina also with the Gearing Group. Nina was unable to join us today, so Athena has stepped in to help us. So at this particular point, I'm going to ask, does anyone have any other questions concerning the retiree plan? I'll be glad to go over any part of it again with you if you wish. And then, yeah, and actually provide you any additional information you need. So please, this is your opportunity to give us any questions or anything that's on your mind that you'd like to know about. Okay, and if you would like, please put your questions, there we go. Put your questions in the Q&A, type them in. I will have to defer this, the plan, it's concerning directly about plan coverage. Brian, could you address this question under the Q&A for Diane? And Ron, you put the word yes. Was there a question you wanted to answer? You wanted to ask? Please type it in the Q&A.
all right, I'm looking for this right now. I'm assuming you're talking about the glucose monitors or glucose meters when you're saying that the diabetic measuring device. You're not speaking of like a pump or anything like that. You're speaking of a glucose meter. Yes.
Yes, Susie,
Yeah,
answer that in the
she said yes.
Q&A, please. Yes, that's what she's asking about.
That's on page 8 of the, if it is the glucose meter, it's on page 8 of the handbook, the Florida Blue handbook, under diabetic supplies, I believe.
Obviously, this question has come up before, Susie. You were able to say page 8. It means you've been asked this question before.
Yes, yes.
So Susie, if you had that information, would you like to provide that?
Well, it just, in the benefit booklet, booklet that came out in the packets, it does say
Uh-huh.
that, excuse me?
Yeah, go ahead. I'm sorry.
Okay. There's a zero copay for diabetic supplies at an in-network retailer mail order pharmacy. And diabetic supplies are listed as LifeScan one-touch glucose meters, Lancets, and test strips. So the specific meters, I think, would have to be a phone call into the Medicare customer service line to first, or the pharmacy that you are going to be requesting them from would need to be authorizing that through the insurance. And you
Yeah,
can-
the diabetic supply company, Brian, for our group is at CareCentrix.
Well, they can go through their pharmacy for,
Okay.
if they have, if it's a pump or anything like that, it goes through CareCentrix.
Okay. Okay, Ron has a question, Susie, that you got yesterday, or you got Tuesday, that you may want to go ahead and clarify here, because you gave a great explanation on how that can be done. It said, looking for a wife's rate of pay to continue on the plan after I sign up. She's 3 years younger than I am.
Yeah, Ron, as I said in a couple of other chats that I've just sent, I can't get you the specifics right now. I am recording this presentation, so the presentation is up on my screen. I don't want to pull up multiple screens for rate sheets. The rates were sent in the packets that were sent out to all retirees, but I can get those rates to you right after this meeting. What happens is it's called a split plan. Once one of the people in the spouse relationship are over 65 and one is under 65, the person on the over 65 side can sign up for the Medicare plan. The individual under 65 remains on the PPO plan. Each one of them pays individual rate based on, and we bundle that together. You will become enrolled separately. So, you will see that you get a Medicare card in your name, your spouse will get a Florida Blue PPO card in her name. She will no longer be your dependent, but have her own enrollment. And then we bundle that in the invoicing. But right now, I can't give you the specific rates because I can't pull those rate sheets up on my screen. But I can send that to you in an email following if you don't have that packet handy that was sent out last week. Let me know if that did or did not answer your question.
So currently, Len and Ron are our two attendees. Do either one of you have additional questions that that one of us can answer for you? Please feel free to type it into the Q&A. Okay, great. Thank you. And Ron responded that it was helpful, Susie. So just to let you know. And he appreciates your help with it. No, thanks. Thanks for the info. Okay. So that was a response from Ron. Like I said, we have two attendees at this point. So are there any other questions? Please don't hesitate. If there's anything in the back of your mind that one of us can answer for you, please let us know and type it into your Q&A. I'll give it a few more minutes. If there's anything you want me to review again before you go, I'd be glad to do that as well.
And Susie, if you get any follow-up questions after this meeting's over, feel free to ask me any questions and I can get you the answers for them, okay?
Thank you, Brian. Much appreciated.
Okay, since there are no further questions, Susie, was there anything else you wanted me to add or augment to what I've provided today?
No, I don't think so. I think everything is covered great. And I learned a lot today, Deborah, so thank you so much. We will see if any questions come in with the forms or if retirees call in.
Okay, sounds good. And if you have any, Brian, if you find, if you know, I'm always here to support you as well. You know, obviously questions and queries should go through you, but I'm always available to help you if you need it.
Thank you very much.
Okay, well, with that, I think I'm going to call this